I'm Dr. Julie Byerley, Dean of Geisinger Commonwealth School of Medicine. I have the honor of being chair of the Institute's Health and Healthcare Task Force. This year, the Health and Healthcare Task Force studied lifestyle medicine. Lifestyle medicine is a medical specialty and approach to care that uses lifestyle interventions as a primary modality for treatment of chronic diseases such as cardiovascular disease and type 2 diabetes. There are 6 pillars of lifestyle medicine: healthy eating, physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. When intersected, these pillars have proven to be an effective approach to prevent, treat, or mitigate chronic health issues. Practitioners partner with patients to ensure that the changes they make are long-lasting. Our study found that this approach for healthcare is likely to be useful in Northeastern Pennsylvania, given the high burden of chronic disease in our region. Lackawanna, Luzerne, and Wyoming counties have higher rates of diabetes than the statewide average. In addition, our region is challenged when it comes to behaviors that can affect health. In particular, Northeastern Pennsylvania has higher rates of cigarette smoking and a larger share of residents with no leisure time physical activity compared to statewide statistics. It's important to remember that while each aspect of lifestyle medicine can be modified to some extent, there are external constraints on what each individual can do. These determinants of health may appear as social, economic, or structural characteristics that affect health, risk, and/or quality of life. Examples include differences in access to fresh food and recreation facilities based on geography, the effects of economic insecurity on sleep and stress, and the effects of age and income on opportunities for social connectedness. Accordingly, consequential demographic patterns and challenges specific to vulnerable populations were noted in the data. Older adults were at a much greater risk of social isolation and lack of physical activity. Alcohol abuse is much more prevalent among young adults and men. Insufficient sleep is reported more commonly by single parents and non-white or Hispanic individuals. Lifestyle medicine interventions are likely to be most effective when the specific lifestyle changes promoted align with the patient's chronic diagnosis as well as their socioeconomic characteristics. Research has shown that integrated approaches to lifestyle medicine can be effective. A program in Texas, for example, known as Community Engaged Lifestyle Medicine, promoted healthy lifestyle changes and addressed health equity using community engagement principles. Universities also play a key role in both promoting and implementing lifestyle medicine programs in communities. Other interventions to directly address the 6 pillars of healthy eating, physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections will be useful in conjunction with the adoption of lifestyle medicine by healthcare providers. Educational programs to increase food literacy, prevention and mitigation efforts aimed at drug and alcohol abuse, expanding access to fresh food, investing in parks, trails, and other recreation facilities, or increasing safe access to them, and providing socially isolated older adults with opportunities for social connectedness on their own terms are examples of interventions that address these pillars. While lifestyle medicine is effective, it can also save money. In a small study conducted by the American College of Lifestyle Medicine, patients living with various chronic illnesses underwent lifestyle medicine intervention. Each participant experienced mitigation in their illnesses, and substantial savings were identified for both the patients and their insurance providers. For example, one of the patients lost more than 150 pounds after committing to lifestyle medicine for 6 months, saving a potential of $92,000 in medical costs. Addressing the 6 pillars of lifestyle medicine, healthy eating, physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections can help prevent, treat, and mitigate many of the chronic health issues prevalent in our Northeastern Pennsylvania community.